I'm Dr. Jeff Kieliszewski, forensic psychologist. So one of the newest challenges that we're seeing in family court cases nowadays involve issues pertaining to children of separated or divorced parents when there's a dispute between the co-parents of whether or not their child is truly transgender and a disagreement about how the parents are addressing this. First of all, let's get an understanding about this concept of transgender from a scientific perspective. A question I get asked all the time is, are there kids that are truly transgender? Well, the answer, based on the scientific research and my own clinical experiences, yes, this does happen. However, it is quite rare. In fact, it's very rare. Nowadays, we are starting to see more children identified in this manner than the research would support in regards to actual cases of authentic gender dysphoria. Now, what is gender dysphoria? The DSM-5 defines gender dysphoria as a marked incongruence between one's experience or expressed gender and the assigned gender. All right? It goes through several criteria: gender dysphoria in children, gender dysphoria in adults, and it talks about a strong desire to be the other gender, and it talks about a strong dislike or rejection of the gender the child was assigned at birth. Now, one key symptom and criteria that's important for this diagnosis is, quote, the condition is associated with clinically significant distress or impairment in social, school, or other important areas of functioning. So it's important to remember that. Now, the reality is that there, in my opinion, is kind of a cultural trend that's going on where applying the label of transgender or the diagnosis of gender dysphoria is increasing much more than the epidemiology research supports. So now, if you are transgender or you have a transgender child, please don't be offended. I'm not saying that transgender, gender dysphoria, or kids who are transgender and have gender dysphoria does not exist. It does. And as a clinician, I can tell you, when you see it, it is very distinct. But the epidemiology research indicates that true, authentic gender dysphoria occurs in about 2 out of every 1,000 boys and about 3 of every 1,000 girls. So, if this is a new psychology trend that's emerging in our culture, this idea of identifying children as transgender or having gender dysphoria at a higher level than the research would support, a lot of times when this happens, you'll see sort of these fervent advocates of this idea. And frequently you'll see clinicians who may push this trend along. Now, I've been studying and working in psychology for going on 30 years now. So I've seen a lot of sort of trends that kind of come and go with different diagnoses. And these, a lot of times, complicate legal cases. Now, one thing that's important to understand, too, is when we see this kind of phenomenon, sort of a trend or maybe some overdiagnosis going on, you will see, particularly social media now, you will see people pass along and utilize information that looks like it's really empirical and scientific-based research when it's really not. It's more opinion, and it's more kind of part of an advocacy movement. When these type of trends happen, it's not uncommon that you'll see individuals, clinicians, parents, who sometimes are kind of quick to jump on this trend. And then a lot of times what you're going to see is you're going to see some inaccurate diagnosis and maybe over-identification. Now remember, the key to support the diagnosis of gender dysphoria is that there is significant emotional turmoil associated with the clinical phenomenon. And in my experience, and the research would support this, you'll see this kind of turmoil emerge most frequently when the child's entering puberty with the true authentic gender dysphoria case. And so this is when you notice that this is when the child will notice the most prominent changes that are occurring in their body that are associated with a particular gender and maybe associated with the gender that they do not feel connected to. And frankly, this freaks them out. It causes a lot of emotional turmoil, and that's what's quite distinct when you see true gender dysphoria and you see a transgender kid. So in summary, gender dysphoria in transgender children, kids, this does authentically occur, okay? But it is rare. In fact, it's extremely rare. We are seeing more of this lately. I would argue it's becoming a bit of a new psychology trend. And anytime a new psychology trend emerges, you're going to see more misinformation that's passed off as scientifically valid information. And you're going to also see people, either clinicians or parents or other advocates, are going to kind of push this idea along. How is this playing out in the family courts? Well, the recurring situation that we're seeing that's leading to family courts having to deal with this is when one parent argues that their child is transgender, and decisions are made in one household in regards to the child's manner of dress, hairstyle, avocations, and even what name they should go by. The other parent is not on board and doesn't agree, and sometimes these cases end up in court. Now, I can give you a couple examples. Just this last week, I saw a mother who claims that her 5-year-old son, biological son, boy assigned, gender assigned at birth, is transgender. She found a therapist for the kid that supports this idea. And now the 5-year-old boy wears dresses to school, has a more feminine hairstyle, and his mother refers to him with a name that's more associated with females versus males. And the mother is encouraging the child to identify as a girl. The dad refuses this, and now they're going to court. Another case I had a few months ago, one parent of a 16-year-old was trying to access hormone therapy for the child to transition gender. The other parent in a shared custody situation did not agree and was not on board with this. That one will probably be going to court as well. Now, frequently these cases present an argument that said that one parent is claiming to support this transgender child, but what they're really doing is that they're pushing the child to identify this way. And that this parent pushing the child to identify this way is more of a manifestation of their own pathology. Now, oftentimes when there's a dispute over the direction of medical care for a child in a shared custody situation, the court may look to experts pertaining to the care of the child or experts about the issue on hand, so physicians, psychologists, social workers, mental health therapists, to educate the court about these issues, to help the court decide what is in the child's best interest. Well, sometimes this falls into a battle of the experts. Then what is the court to do? So when I get involved in these types of cases, I often advise and educate the court or the attorneys or any parties involved. Everybody needs to kind of take a step back and look at the good established child development research first, and then bring in the idea and opinions associated with, is this child truly gender dysphoria or transgender? The first issue that I advise is let's look at the age and developmental level of the child. Does a 5 or 6-year-old have the dispositional capacity to make decisions about their identity that will change the way they fit into society? Do they recognize or have the cognitive capacity or competence to weigh potential consequences or hypothetical scenarios that could occur if they choose to espouse any particular type of identity? Now, does a 15 or a 16-year-old have a different dispositional capacity for these kind of decisions about what gender they want to identify with versus a 5 or 6-year-old? And it's important also, when you look at child development research, to understand that what is established as typical and normal behavior for a child based on their age and developmental level may fall under what's called gender atypical behavior. And gender atypical behavior is showing interests or behaviors that are associated with another gender. This is very normal, especially for younger children. There's a bunch of child development research on this topic, right? Being a tomboy doesn't mean you're transgender, right? So We also need to recognize that exploration or even preference for gender atypical behavior needs to be distinguished from legitimate gender dysphoria. Now, the second issue is this accurate diagnosis of gender dysphoria. Again, exploration or even preference for gender atypical behavior does not equal gender dysphoria. Look at the diagnostic criteria, it's very specific. And the main one is there needs to be significant emotional turmoil that affects the child's functioning. That turmoil obviously associated with the different symptoms or aspects that would support a gender dysphoria. And secondly, there's also this assumption that if a child does show signs of authentic gender dysphoria, particularly a younger child, that there needs to be some type of radical intervention. The child needs to be involved in counseling to transition their gender identity, that they need to change their entire social systems, they need to change their lifestyle, they need to change their name. That this is needed in order to help the child move on to this new identity. Well, the research doesn't support that. In fact, there is some good empirically based research that talks about it's not uncommon for children to show some gender dysphoria pre-puberty, and then after they go through puberty, they end up not showing gender dysphoria anymore. Follow-up on that research is that those kids frequently were more confused about their sexual orientation rather than what gender they identified most with. All right? So, identity exploration is normal in adolescence as well. Identity exploration or identity confusion does not equal gender dysphoria. The third thing I'll advise in these types of cases is if there's a concern that one parent is convincing or trying to push a child into being transgender, and that this is a manifestation of their own pathology, let's do psychological capacity to parent evaluations on both parents. Does this alleged convincing or pushing the child to be transgender, is this due to a personality disorder of the parent? Or is this some other type of psychological dysfunction that's manifesting in the parent and motivating this behavior? Now, as you can imagine, the issue of a dispute in a co-parenting situation about whether a child is transgender or not, and the other parent disputes and one says that they are, and then there's a therapist or two involved, it can become very complicated very quickly. And it can be very tricky for family court judges or even the attorneys involved to try to navigate this situation. So this is an issue that also elicits a lot of passion and advocacy from people sometimes. There are organizations that have become involved in these court cases, pushing their own agenda. And that there's also a lot of times a lot of misinformation is brought into these situations. Information and that's really not scientifically validated. Okay. We could talk a lot longer on this topic. If you have any comments, questions, please put those in the comments section. If this is the kind of thing you're interested in, please pass the link along to others. Subscribe to the channel. I'm also on social media. Check me out there. I'm on Facebook, Instagram, Twitter, and TikTok. Everything is under Dr. Jeff Kieliszewski, Forensic Psychologist. Thanks.